Sponsored by rxcardclub.com. Get a free prescription drug card and save up to 85% on prescription drugs. rxcardclub.com. Recognizing untreated Lyme disease and getting treatment. Lyme disease is a bacterial infection spread by blacklegged ticks, commonly known as deer ticks. It is the most frequently seen vector-borne disease in the United States. /r/n/r/n Symptoms of Lyme disease vary based on the severity of the case. The most notorious symptom, bullseye rash, doesn't occur in everyone and can go unnoticed. Other symptoms may resemble those of other illnesses. This is why it is possible to be unaware that you have Lyme disease. /r/n/r/n Lyme disease that goes untreated for many months or years may be harder to treat with antibiotics. Untreated cases can progress to serious, even fatal, health conditions, from arthritis and nerve pain to cardiac arrhythmia, irregular heartbeat, or Lyme neuroborreliosis, inflammation of the brain and spine. /r/n/r/n-Verywell, Jessica Olahrnrn Its important to understand more about Lyme disease, what can happen if it goes unmanaged, and what can be done to treat it. The more vigilant you are, the better off you'll be. /r/n/r/n Lyme disease is carried by the blacklegged tick, also known as the deer tick. This tick is found in the northeastern and upper midwestern United States. On the Pacific coast, Lyme disease is spread by the western blacklegged tick, also called the deer tick. /r/n/r/n When an infected tick bites you, a bacteria called Borrelia burgdorferi passes from the tick into your bloodstream. In order for this to happen, the tick must be attached to you for 36 to 48 hours. Most people are infected when they are bitten by immature ticks, which can be difficult to see. /r/n/r/n Lyme disease causes a range of symptoms that change and intensify as the Borrelia burgdorferi bacteria spreads to the rest of the body. Untreated cases can cause serious problems or lead to a fatal condition. What's tricky, too, is that the onset of initial symptoms occurs anywhere from 3 to 30 days after exposure. /r/n/r/n Clinically, there are 3 stages of Lyme disease: early localized disease, early disseminated disease, and late disseminated disease. /r/n/r/n Early localized disease, the initial manifestation, begins between 3 and 30 days after a bite. It is characterized by /r/n/r/n Disseminated Lyme disease symptoms arise as the bacterial infection works its way to other bodily systems, organs, and structures. Typically a month or more after exposure, symptoms are mostly neurological and can include /r/n/r/n In its late disseminated phase, the bacterial infection has begun affecting nerve and joint structures, causing significant complications. This stage can begin weeks, months, or years after the tick bite. /r/n/r/n If unchecked, the Lyme disease infection can spread to other bodily systems, causing significant damage. Untreated, complications of this condition can be very severe. /r/n/r/n Even in cases where Lyme disease has progressed, antibiotic regimens, especially drugs like doxycycline, are generally successful in resolving problems. /r/n/r/n Some see relapses of their condition despite treatment, something that's commonly termed chronic Lyme disease. Clinically referred to as post-treatment Lyme disease syndrome, PTLDS, this is the persistence of fatigue, nerve and skeletal pain, and cognitive difficulties more than 6 months after treatment has ended. /r/n/r/n There's some debate about why PTLDS occurs in some but not others. Some believe it's an autoimmune response triggered by the original infection. In addition, there is no consensus on treatment for this condition. Studies have shown that antibiotic treatments don't help those with this condition. /r/n/r/n Since Lyme disease can take different forms, and since it's often confused with other conditions, it's important to be proactive if you suspect the condition. What signs prompt medical help? Call the healthcare provider if /r/n/r/n. When it comes to cases of suspected Lyme disease, several factors help healthcare providers determine a diagnosis. Here's a quick breakdown of what's taken into account, /r/n/r/n in those cases of untreated Lyme disease that have become more advanced and serious, as in its late disseminated phase. Additional testing may be needed, /r/n/r/n. It's difficult to get exact numbers when it comes to Lyme disease, in part because there is only limited accounting of the condition's frequency overall, and it's often misdiagnosed or mistaken for other conditions. /r/n/r/n. Currently, it's estimated that 476,000 people develop it in the United States every year, with 81% of the cases clustered in the Northeast, Upper Midwest, and Mid-Atlantic regions. /r/n/r/n. A significant but shrinking proportion of those with the disease end up progressing without treatment. Current estimates are hard to come by. In 2012, researchers estimated that about 16% of Lyme disease cases present without rash, increasing the chance that the case is missed, overall. From 1.6% to 7% of all infections have no symptoms. /r/n/r/n. Knowledge and awareness of this disease have grown over the past couple of decades, greatly improving outcomes. This improving prognosis is associated with better care and detection, leading to timelier intervention. /r/n/r/n. If you live in a hotspot area for blacklegged ticks, never hesitate to reach out to your healthcare professional if you're feeling sick or have a rash. /r/n/r/n. While it's always good to be careful about Lyme disease, especially if you live in an area where blacklegged ticks are native, there is also some perspective necessary. With effective medical intervention, this condition is easily and swiftly managed. Improvements in detection have also caused drastic reductions in associated complications. /r/n/r/n. With increased awareness of Lyme disease on the part of the broader population, it's only natural that reports of this condition rise. His doesn't, however, mean that you're at greater risk or that you should avoid the woods. It simply means that people and healthcare providers are doing their respective parts. /r/n/r/n. Ultimately, Lyme disease doesn't affect all that many people, and even less likely are cases where it gets severe. Nonetheless, don't hesitate to get help if you suspect you have this condition. Good communication increases the chances of early detection, leading to timelier and more effective treatment. /r/n/r/n. Yes, symptoms of Lyme disease can often go unnoticed. An estimated 1 in 6 people with Lyme disease do not experience the telltale rash, and up to 7% of people with Lyme disease have no symptoms. /r/n/r/n. Left untreated, Lyme disease can spread to joints and organs, causing significant damage. Arthritis, heart disease, and nervous system problems are common complications of untreated Lyme disease. /r/n/r/n. In the initial stages, Lyme disease is diagnosed based on the appearance of a bullseye rash after a blacklegged tick bite. Other symptoms that may accompany the first stage of Lyme disease include fever, fatigue, headache, and joint pain. It is often described as feeling like the flu. /r/n/r/n. Blood tests are used to confirm a Lyme disease diagnosis. However, the test checks for Lyme disease antibodies, which often are not present in the early stages of infection. Blood tests are used to diagnose later stages of Lyme disease. /r/n/r/n. rxcardclub.com. Get a free prescription drug card and save up to 80% on prescription drugs.